Hand hygiene. Sounds simple, doesn't it? Well, actually it is. The simple act of washing your hands properly can help to keep you from getting sick and from spreading germs to others. If you want to know how many germs can stay on your hands if you don't wash them thoroughly, here's a demonstration that will show you. Rubbing a lotion called Glow Germ on your hands simulates the spread of germs. If you then wash your hands as you normally would and hold them under a fluorescent ultraviolet lamp, any spots you missed will glow. As you can see, the results are disturbing. Hand washing is one of the most effective ways of reducing the spread of the flu virus and other germs. Proper hand washing isn't just important during a pandemic flu, it's important every day of your life. You should always wash your hands after using the restroom, after coughing or sneezing, or blowing your nose. And of course, it's always important to wash your hands after using a public restroom and to use a paper towel to dry your hands, turn off the faucet, and open the door. One way you can pick up harmful germs is by touching any surface that someone with unclean hands has already touched. Another way is to touch a surface that someone has sneezed or coughed on. If you don't wash your hands thoroughly, you can spread those bacteria to your body by touching your eyes, nose, or mouth. You can also spread the bacteria to others by touching the things that they then touch. Flu viruses can live on hard surfaces for up to 72 hours and sometimes more. You can also spread germs by handling food with unclean hands, so remember to wash your hands before and after preparing food and before you eat. You should always wash your hands while at a hospital or medical clinic, after handling money, and after shaking hands. Also, remember to wash your hands after playing with pets. The basic rule is that you should wash your hands anytime they get dirty or anytime that they're exposed to germs. So let's take a look at the proper way to wash your hands using soap and water. When using bar soap, be sure that the bar is free of cracks. Cracks can be hiding places for bacteria. Wet your hands with warm water. Apply soap to the palm of your hand and rub your hands together vigorously to create lather. Thoroughly cover every part of your hands and fingers with the lather, including your thumbs and the area between the fingers. Work your fingertips into your palms to clean under the fingernails. Continue for at least 20 seconds. Rinse hands well under warm running water and then dry your hands with a single-use paper towel or clean cloth towel. Use the same towel to turn off the faucet. To help children wash long enough, have them recite the alphabet or sing a song.
Q-R-S-T-U-V-W-X-Y-and-Z. Now I know my English. Next time, won't you sing with me?
It's always best to use soap and water, but if soap and water aren't available, alcohol-based hand sanitizers may be used. It's best to choose a product that contains at least 60% alcohol. Don't add water to this type of product. To clean your hands properly with a sanitizer, add a small amount to your palm. Use enough to keep your hands moist for 15 to 20 seconds. Rub the sanitizer into your palms and thoroughly cover every part of your hands, including the back of your thumb and between your fingers. Rub your fingertips into the opposite palm to clean under your nails. Continue rubbing for 15 to 20 seconds. Don't use a towel to dry your hands. Instead, keep rubbing your hands together until they are dry. It's always best to wash hands with soap and water when available. That's especially true when they're visibly dirty or you have handled bodily fluids. And remember, it's recommended that you wash with soap and water after 5 to 10 uses of hand sanitizer. I hope you can see how important proper hand hygiene is to your health and the health of your family. Proper hand washing is the #1 way to prevent the spread of germs, and it can make the difference between getting sick and staying well.